Good morning, friends. Welcome back to my YouTube channel, Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe my channel and also please give your valuable comments. And we were discussing about cough and different case studies. Already we have covered two important cases. Today we will have case number 3. Now, when you see case number 3, see this is a case. It's a very interesting case. Okay, a 2-year-old child with a fever, cough and cold for last 4 days. Mother comes to you and she directly tells you, dictates you that my child is 2 year old and my child is having fever and is also having cough and cold since last 4 days. Okay, so when you ask the details, mother says, ask the details. Mother says the fever is very acute in nature. Suddenly it started. Okay, and she says that out of all these symptoms, cough and cold, fever, which is the one which is started first. Okay, fever is started in the beginning, and she is telling the child is not much active. Child is not much active, and there is a cold and cough for last 4 days. Child is also having more cold and cough for 4 days. So according to the history given by the mother, the predominant symptom is very clear. It is fever. Okay, isn't it? So whenever there is a fever, we suggest that we always infer that there is a infection, and it may be a viral infection or it may be a bacterial infection. But what mothers told is the child is not much active. So dull child or sick looking child mostly suggests to have a bacterial infection. But mother is also telling cough, cold, etc. is there since last 4 days, and it is also severe. So cough, cold, such many symptoms are there along with the acute onset of the fever. So I should also think about viral fever. But one of the important clues that she is giving is child is not much active. Okay, sometime maybe in some cases, even in case of viral fever, also child may be dull. Otherwise, usually in the viral fevers, interfebrile period, child is very active and playful. But this is one confusion here. Anyway, we will see what happens next. So it's natural. The child is having cough, cold, and multiple symptoms are there. Acute onset of the fever is there. Except that mother telling that child is little dull in between. Usually, every mother says like that, isn't it? So sometimes mother also exaggerate the things. So considering all these points, we have considered this as a viral infection. Okay, because there is acute onset, cough, cold, fever, and also some sound is coming from the throat, and mother is telling everything. So multiple symptoms are there, and therefore definitely this would have been a viral infection. Of course, the course of the fever is just 4 days. So whether the fever is coming down gradually or whether the fever is increasing gradually, within 4 days we cannot assess that, because even in the viral fever also for 3 to 4 days we have got the fever. So by this time we can diagnose this as a viral infection, upper respiratory tract infection. But what happens, fever on the day 4, okay, on the 4th day, also fever is not decreased. Fever is continuous even on the 4th day, 5th day also. Then the physician has got the doubt. Now he now told to open the mouth and show your tonsils. So when the tonsils are examined, and he find some of the follicles in the tonsils, some exudation is present in the tonsils. Now the diagnosis is changed. Previously our diagnosis is viral infection. Now the diagnosis is changed. Now our diagnosis is now tonsillitis, because tonsillitis. Okay, the diagnosis is changed. Okay, the diagnosis is changed and we have rescheduled our started our treatment. But as a physician, as a pediatrician, we should know what mistake we have did. What mistake we have did. The main mistake that we did is when the parents come to you and say, my child is having cough and cold. Actually, parents are not knowing the difference between the cough, cold, etc. Any sound which is coming from the respiratory tract, they consider as cold. Sometimes sound may be coming from the nose, sound may be coming from the oral cavity, sound may be coming from the tonsillar area, sound may be coming from the pharynx or larynx. It may be sometimes a simple stridor, or it may be some simple obstruction because of fluid and all. Any sound which is coming from the upper respiratory tract, the mother considers it as cough and cold. And if you blindly believe in that, then you will have the mistake. You done the mistake. So in this patient, there was some sound coming from the throat. Maybe it is because of the noisy breathing. Tonsils are now enlarged. Because of the enlarged tonsils, it is causing some partial obstruction there in the airway, and because of that some noise is coming out, and mother is appreciating that particular noise as a cough and cold, and she told same to you, and the physician blindly believed it. So actually there is no cold or cough in this child. Actually this child has got enlarged tonsils, because of which some noise is coming. Okay, and that noise has been wrongly appreciated as cough and cold by the mother, and you also believed it, and that's the big mistake. Okay, so that is we missed the leading diagnosis. So this is a case of tonsillitis, because mother is telling that child is not looking so well in between, and we have also overestimated at that particular or neglected that particular symptom. So child is not well during in between, child is not playful or active in interfebrile period. Again, bacterial infections, acute tonsillitis can cause the acute infection, and actually it is a localized infection with only enlargement of the tonsils, and there is a fever, and cough is what mother appreciated, wrongly appreciated. Okay, so diagnosis is now changed from viral infection to tonsillitis. Usually tonsillitis is bacterial tonsillitis. Okay, it's caused by the bacteria. So now why I have put this case here is examination of the throat is very important in each and every case of the cough, and don't blindly believe what mother says, because mother's appreciation is different. Okay, and here so we have to be very, very careful. So this is the mistake which we have done here. And so always examine the tonsils and throat area whenever a child comes with the upper respiratory infection, to rule out the tonsillitis and so many other things. Okay, now rationality, that means now if you consider the same case in terms of Ayurveda now, so this can be considered as a Pitta Kapha Kasa. Okay, similarly in Ayurveda also we will have the confusion. When the patient comes to you, we first diagnose as Vata Kasa. So then we come to know that there is emergence of the fever, then we will include pitta there. So then some sputum is coming out, so then we will also include kapha. So that means initial evaluation of the patient should be very, very clear. Okay, so in this case a fever is there, and also there is some enlargement, obstruction, growth, swelling is there, so we can consider this as pitta kapha kasa. Okay, or we can also include this under pitta kapha jwara. Okay, pitta kapha jwara associated with the pitta kapha kapha. So so that can be seen. So for this purpose I have put this case. So what treatment you can give? You have to go for the treatment of a Tundikeri treatment, or you can go for the treatment of Galaganda, or so that can be given here. So we have to go for one Jwarahara medicine here basically, and again we have to go for one soothing agent and some other medications to relieve the obstruction. So that I told that the details of such medications we will deal in the future classes. Thank you very much for patience here. Don't forget to subscribe my channel, and also please give your valuable comments. So this case is to show the importance of physical examination, especially examination of the throat in any conditions of throat. Don't blindly believe on the words of the patient, that may lead to misdiagnosis. Okay, so always confirm by examination. Thank you very much.